Welcome to Healthcare Algorhythm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. Hello again, everyone. It's great to have you in the Healthcare Algorhythm. Welcome back. I'm Dr. Will Strimel. We are continuing our conversations around the care of seniors and the leaders that are driving innovation in that space, both in terms of technology and operations. Now, my cardiology practice is primarily focused on patients in the hospital, and universally, the question that they and their families come up with right away is, when can I go home? And seniors being in their home is clearly associated with important clinical benefits, not the least of which is increased functional ability and even decreased hospitalizations. Today, we're speaking with someone who is committed to supporting that mission. We're joined by Ethan Guerrieri, the Vice President of Operations at Preferred Care at Home, where he helps scale and support a network of over 130 locations nationwide, all supporting seniors aging in place. Ethan, it's great to have you with us.
Happy to be here. Thanks for having me on.
My pleasure. So if I understand it correctly, Preferred Care at Home is a family business. So maybe just tell us about what you do and how it got started.
Yeah, absolutely. You're right. It is a family business. It actually started back in 1984. It was my grandmother, mother, and father. My grandmother was a nurse and had an extra bedroom in her home. And back in 1984, care was in the home was like thought of, but not really practical. When you aged, it was like you aged. If you didn't have a family member to become that constant, you went to a nursing home. And that was kind of like the cycle of life in the continuums. And so she had an extra bedroom in her home and puts an ad in the newspaper. I'm a retired nurse, have an extra bedroom. Gets a call the next day. Lady walks in, walks through the house, sees the extra bedroom, and says to my grandmother, "This is a nice home. I like it. But can you come to my house?" And my grandmother said, "I can't, but I know somebody who can." Right. And fast forward over 30 years, actually now 40 years later, wow. Here we are today. In 2007, my father, what has made us so successful, streamlined that business model and franchised it. And so you can find Preferred Care at Home in, like you said, 130 different locations through franchise partners in 20 different states.
Wow. And so at a high level, I mean, we'll dig into it, but what does that look like? How do you work with seniors to keep them in the?
Yeah, absolutely. So when a senior ages, they're really left with three main options at this point. One, do you have a family member to step up and become that constant? If you do, a lot of the time we'll see family caregivers. So with that, we start to see a little burnout with the family caregiver, but that still is an option. Two, going into what we know as assisted living facilities, which are beautiful communities. And indirectly, that would be like a competition for us, but it's not, because it's a great alternative. Mm-hmm. And then the third option would be home care. And so as we age and we need help and we need that constant, home care is looked at as that option to keep people in the place that they ultimately want, which is home, with our one-on-one support necessary to do so. And so that's what we help families and seniors navigate, is when is the right time to ask for help.
Right.
And a lot of the time, William, what we see is it's usually because something's happened. Very few people are proactive on that approach. And you mentioned something in your intro where you talk about rehospitalizations, readmissions. We usually get them on that after that initial hospitalization. That's when family members realize we need some help.
Yeah, and I bet, and I've had a conversation with another leader in the senior care space about this recently, is there those even in the skilled, post-acute, and even some assisted living places, they're also seeing that decision point is often being forced on patients and their residents, their families, patients, their families. So I would guess when you see that, or you're faced with that now quite a bit, what are the initial problems or the initial considerations that you have to kind of solve right up front or think about right up front?
So education is huge. One of the things I always say to our franchise partners is you can never assume healthcare professionals understand where home care comes in and fits in, as well as families, right? The number one question that we get is, does Medicare pay for this?
Okay, sure.
And the answer that we want to say is no. But it maybe because what are you looking for? Are you looking for someone to come into the home who's a PT OT, maybe a nurse to come in and do some physical therapy for about 3 weeks, then yes, that is something Medicare does pay for. So it's an education piece. In healthcare, I believe we throw around these terms to family members and seniors, and we assume they know what we know. And so at home care, our main job is to educate where are the gaps of their insurance, where we fit in, not duplicating, but coming alongside those gaps and providing the necessary care to keep somebody safe. And so I would say the first step is education, because no one wants to, unfortunately, and we get it, pay for care if they don't have to. But for most seniors, if you are on Medicare and not on Medicaid,
Hmm.
and you have financial stability, you're going to be forced to pay for care out of your own pocket if you don't have long-term care insurance. So educating where their insurance gaps lie and where we come in and provide in its absence is the first step. Going to the facility side of things, I do believe in our experience, private duty home care is, and I want to say this correctly, it almost looks as like a luxury item because it's private pay.
Hmm.
But what we see in the current HRRP, hospital readmission reduction program, is readmission is an issue. And if you look at the reason why seniors are ending up back in the hospital within 30 days, it's the four of the six reasons are because things that are happening at the home.
Right. And
And that
we'll throw around the term on our end, and maybe you do as well, this term of the social determinants of health, right? But they often have to do exactly like things that are outside what this prescription, the prescriptions might be right, the tests might be right, everything might be buttoned up, but there's things that are just happening that we can't see
exactly.
that lead to this, right? So I suspect then when you're receiving people who have a whole different set of needs. I mean, no one person is likely going to have the same exact needs. So therefore, I imagine it has led you all to develop somewhat of a portfolio or a range of different lines of services. So maybe just tell me about the different things that you guys provide.
So for our care one-on-one, because we're not government subsidized, it is completely catered to the client's wants and desires. You can find preferred care at home providing care 1 hour a day, though we don't like it because I think we'll talk about it later in this podcast about the biggest hurdles our industry is facing and obstacles. But we can provide care from 1 hour a day all the way to 24/7. So we really come alongside that family and our clients to be able to put together a care package that is unique to them. See, in our industry, a lot of people will talk about block times, 4 hour blocks, and we'll be here for the morning care. What I like to do and what we like to do here at Preferred Care at Home is look at the client. We call them clients. Look at our clients individually and find out what are the needs that you have, and then B, what is the budget you have allocated to fill this need.
Okay.
And then what we'll do is we'll create a custom care package that consists of all the ADLs and IADLs, whether it be from bathing, dressing, toileting, to light housekeeping, meal preparation, companionship, transportation, all the necessary services to keep a senior safe and have quality of life and dignity in their home. We'll be able to create a custom care package around them, providing those services so that home can always be an option within their budget that they have towards care, which is
And
one
just
of the
so everyone knows, ADLs refers to activities of daily living, and I guess I stands for independent. I'm going to take a stab.
instrumental.
Instrumental.
Yes.
Okay, so what's an instrumental IDL then?
Yeah. So instrumental so this is the best way to think of it. Activities hands-on, right? You need to be there to be able to do it. So think of transferring out of a chair. You have to help them get up and out. Think of getting them on the toilet, bathing, dressing, hands-on. Instrumental is more of companion based, hands off. Equally as important though. So a lot of people think like ADLs, okay, that's the important one. No, instrumental are equally as important. Medication reminders, meal preparation, light housekeeping, transportation. And then, in my opinion, the biggest one, which is companionship. We're not sticking warm bodies out there to do these services. We're building connections for seniors so that they're excited ultimately when somebody's coming in there, their normal caregiver, to be able to help them with all these activities.
Okay, so you guys really interface at potentially all aspects of the senior's day-to-day experience. Of course, a big one of those is healthcare. So maybe give me a sense of where you come in the healthcare piece. I mean, you're not clinicians, I don't expect, but do you work in and around the healthcare experience at all in terms of going to visits, helping coordinate care, helping with medications, things like that?
Of course, absolutely. And this is my whole point is in my opinion, for the missing link to quality care for a senior is home care. Obviously, I'm a little biased, but you said it. We're in the home. We're seeing what's going on. You get at best maybe an hour with the as a doctor with the client if you're the PCP. We get 20, potentially 24 hours with those clients. And so where we end is as they, let's take an individual who's in the hospital and gone through 20 days of rehab and now is coming back home.
Huh?
Home health is in there doing their PT, OT in the home, as well as us helping them with all those activities because they're in there doing the physical therapy. Maybe they're doing a bath or dressing a wound, but they're in and out. And that's only going to last 3 weeks. So yeah, we're in there providing in their absence. Additionally, one of the big reasons for readmissions is missed doctor's appointments, missed
Right.
follow-ups, not going to specialists. Do you know who the people that make sure that they understand where their doctor's appointments are and what time and then takes them there? That's home care. That's us. So we're the ones who kind of bridge that gap between, hey, here are your appointments. Here's what needs to be done. I'll give you another example. Like let's say PT is in the home and they're giving them a lot of the PT that happens on home health is homework based. Hey, we did this exercise. I want you to continue that until I see you again. Do that tomorrow, do these things tomorrow. And then when I see you again, we're going to do something else. We're the ones that encourage that continue exercise for physical therapy to ultimately improve. So we provide in really all the major gaps of the facility care and the continuum.
So one thing I know, especially for seniors that they and their families struggle with, is that we have a very fragmented healthcare system.
Exactly.
And they're seeing lots of different doctors, lots of different specialists. Then you bring in therapists, especially again, you're receiving people probably at one of their more challenging times. Often you're just getting to know them when they've just come out of a hospital. Now they have perhaps a new functional impairment that they really want to get through. So how do your teams fit into that care coordination piece, and what kind of tools are you using? Because I hear a lot of people still struggle with the fragmentation and keeping it all straight.
You got it. So uh, I think it's every senior will have 8 specialists that they see on average. So we're talking an incredible amount of doctors and doctor's appointments if they ultimately follow up with them, which we know they don't. What we've done is for individuals leaving a hospital, because this is one of the major reasons why seniors get readmitted into the hospital is missing doctor follow-ups and not going to their necessary primary cares. But we developed a 15-piece toolkit designed around seniors being able to take control of their own care, as well as our caregivers and our team understanding where where our client essentially lies. And so every time we get a new case, we put together that 15-piece toolkit, which identifies chronic illnesses, all their specialists, the follow-up doctor's appointments. And so that happens at intake. And then from there, when we go and take them to, let's say, their PCP, we're able to continue with those necessary follow-ups. We always partner with a local pharmacy that our caregivers are used to using for medication mismanagement.
Okay.
Personally, I'm a big fan of the bubble packs that come in almost like a gummy pack that has all their medications for the morning and in the
Right.
evening. So we try to make it as streamlined as possible that our care team understands, so it's uniformed with as we bring on new clients.
Okay. And so you mentioned your care team. One thing I don't know for sure, so I'm asking without knowing the answer to this one, but I know in my world and in many places where we deliver care, workforce staffing shortages are real, and it's a high burnout field. So tell me a little bit about how you guys think about that, how you're addressing it. Is that an issue, or what do you do to really keep a stable support medical care team in place?
Yeah. So you use the term burnout, and I would say burnout maybe, turnover absolutely.
Okay.
And so I believe home care has the opportunity, and what we're seeing at preferred care at home. But pre-COVID, let's talk about pre-COVID. Pre-COVID,
That
I
is
could
definitely a line in the sand, right? A lot
exactly.
changed in our world with that for sure.
Exactly. So pre-COVID, you could open up your home care agency and you have caregivers knock on your door looking for work. That's how we tell time. Kind of like, when Jesus came, it's before Christ and after Christ.
Right.
Home care, pre-COVID, after COVID. It's different. Now we have to go after our caregivers. And so when we didn't need, William, bluntly, we didn't need a retention program because we always had new caregivers knocking on our door.
Mm-hmm.
And so what I would say is we've always been extremely aggressive on the way that we recruit. Our process is proactive, not reactive. We're constantly onboarding care because we know what the data is showing us. We see what our lead flow looks like. There is a huge need for agencies like Preferred Care at Home to step in the gap for families. Here's a problem: the quality of care. So we're recruiting at a high level, but are we recruiting and the bottom of our can is open and they're just leaving? Do we not have a strong company culture or a really good retention campaign? Because historically, William, in our industry, I can't speak about any, caregivers are just a means to an end. Hey, I'm going to use you until you used it, burn out. But I say, hey, they're done with you, so they're going to find someone else that treats them a little better. Once you're done, I'll find someone else and I'll replace you. So we're having to shift our perspective as home care operators and realize it's about developing a company culture, including that caregiver into it. I'll give you a couple other things I want you to consider about our industry. I don't have the luxury of seeing my caregivers come into my office like a facility every day. And I can't tell if they're having a good day or a bad day, and I can't pick them up. I don't have that luxury. I don't have the luxury of making sure that they have companionship with other coworkers because they're working alone one-on-one with the
Uh-huh.
client. And so we have to take, if I let it, a caregiver who is a good caregiver is operating on an island, which
They're on
means
an
they're
island.
clocking in, clocking out. I'm not hearing from them. So that can actually happen with quote unquote good caregivers. So we have to make necessary efforts to engage our caregivers regularly to make sure that they feel appreciated, seen, they're on a growth trajectory, and that there's nowhere else they would want to work because they know if they get a flat tire, they're going to call our office and our office is going to pay for that flat tire because they're a part of a care team that cares about them.
Uh-huh.
That's not common in this industry. So I would say I want to meet your problem or our industry's problem with a huge opportunity to love greatly on our care team, which has not happened in really the history of home care.
Well,
And
that is
so
great to hear that spirit because so many, most of us, almost all of us, come into healthcare with the mindset of doing good for other people, right? So you're already you self-select out good people who want to come, who are showing up to give their extra, give what they can to help someone else. But there's so many fires burning in the administrative part of medicine, is that it's very tempting just to treat that as a commodity. And the minute you do that,
exactly.
and this is true whether it's the person that meets you at the desk or the doctor or nurse practitioner or PA who sees you in the office or the person who does your billing. It's all a very highly trained workforce. And to
Exactly.
lose one person, the replacement costs are huge. That's great to hear you give kind of life to this idea that we really have to think about and take care of our workforce because one day they're the ones who are your success depends on them, right?
And we talked about, in our pre-podcast kind of discussion, we talked about technology and how technology can really streamline this process. And so we use obviously uh, client management software. And then there's platforms that we can plug into that. So as caregivers do the mundane things like clock in, they
Mm-hmm.
get rewards. Clock out on time, they get rewards. Pick up an open shift that we needed to fill, they get rewards. So they're getting recognized for doing the normal things, weekly raffles that are web based, and they get announced on our platform. It's not difficult, but it's required in order to really take home care where it needs to go here in the next really 5-10 years, as these baby boomers start turning 65, 75, 85, which we're seeing now. I think the oldest baby boomer today is turning 81.
Right.
So our clientele average is 85. So we're about to see that wave start to crash.
Yeah, so that's a great segue into the next area I wanted to cover, which is as you look at the industry now, what are and yourself and even whatever the people who are doing things similar to you, but just kind of stepping back as an industry leader mindset, what are the big challenges that exist? And what are you excited about that's going to be different, specifically since you referenced technology, these newer technologies that are coming out? What are the things that they're going to be able to solve in that space, or you hope that they're going to be able to solve in that space?
Transparency of care, that's what we're already seeing. Back in the day, there's we had a portal, right? And this was in 2015 when I started. There was a portal that our clients could log into, and they would be able to see the shift in real time if the caregiver clocked in and clocked out. Remember, at that time, we were like, "Wow, this is
Right.
transparent," And now, with all the great advancements in technology with our care, when you get Preferred Care at Home, you get so many cool tools that families can access: movement of the clients, sleep of the clients. Uh, are they moving enough to perform over their ADLs? How is their gait speed? I mean, it's just what it's doing for us is it's indicating, not only giving families peace of mind that care is going on and that their loved ones are progressing through data,
Hmm.
but also it gives us pre-indicators that when things are on the wrong trajectory, hey, maybe you see mom's getting up earlier. We arrive at 11, but she's out of bed at 9. We maybe
Yeah.
need to get care earlier. And her movements aren't working as well to perform these ADLs necessary
Wow.
to stay home safely. And so
So are you integrating, for instance, wearables and things into your own
exactly.
platform?
Yep. Yep. Wearables. Yep. Absolutely. And what's great about it is these wearables, even 2 years ago, would be hundreds of dollars.
Hmm.
Now, because of the advancement of technology, it's included with our services because we're able to afford it and we're able to package it in with a lot of our care. Now, this is not all of our locations, but this is some of our
Sure.
locations implementing this. So I would say one, the transparency of care and realistically utilizing technology, not shying away from it, but embracing it as a tool to perform better care, not only for our clients, but also for our caregivers and giving family members that really what they desire, which is a peek into how is mom doing, where I can just log in or open up my app and see important data that indicates that to me is what we're seeing.
What still hasn't been solved that great yet, or maybe are they not thinking about? If you could sit with a developer and you could say, "Hey, fix this one thing for me," what would that be? Or you have
Oh,
any thought?
that's a really good question. I don't know if I have a good answer on that.
Okay.
That's a good
Or
question.
maybe when since you work a lot with the owners of the franchises throughout the country, is there a consistent pain point that they're coming back to you with?
Yeah, I would say most of the major pain points our clients have is when caregivers call out the communication
Workforce.
between
Yeah.
the workforce. Is there a way for us to ingrain clear communication through everybody else? Now, we have some great partners like Access Care and WellSky who are constantly advancing their technology and embedding AI. But I would say more or less engaging the workforce when things do go wrong to be able to provide a clear solution quickly for our clients.
Got it. And you mentioned a few times throughout the show about families. So maybe give me your perspective. Obviously, the focus is on the care of the senior, but that care takes a lot of people, right? And almost universally there's family members involved. So how do you engage family members? How do you think about what are are their concerns changing, evolving over time that as people become more complex?
Of course, absolutely. We had a ad on our website, not an ad, like a page on our website, and it said, "Be the daughter again." And I can't tell you when I operated my home care agency how that spoke to so many people because they found themselves as remember we talked about those 3 issues, those 3 ways that seniors will go for help
Yep.
as they age. When they become that constant, they're taking care of mom and they're the caregiver, they're no longer the daughter. And when you
Right.
say, "Hey, be the daughter, allow us to be the caregiver," uh, I, it shocked me how much kind of resonation that had with a lot of individuals. So I would say we're constantly communicating with the family members. Hence why I even discussed about the technology in the past of giving transparency because family members have their own lives going on. They have their own kids. They talk about the daughter who is raising daughters and has a mother, right? And it's juggling all those things. So how can we give them peace of mind that mom's not only being cared for, but cared for well and allow her to become in the loop on the areas that she wants, not overburdening her, knowing that she has an agency to ultimately take care of that. And so we're in the business at Preferred Care at Home of solving problems. And so what we need to do during that assessment and that intake is what are the
What
problems?
are the
So
problems? Yeah.
every problem is a little bit different. Some family members want to be more involved, some families want to be less involved. And so whatever that problem is, ultimately when they hire Preferred Care at Home, they're hiring an agency that understands, hey, what's going on? One of the first things we do is it's called uncovering the need. No one's calling Preferred Care at Home because they're having a great day. It's really sunny. And they're like, hey, we're on our way to the water park. Let's
Right.
call Preferred Care at Home. It's because something's happened. So uncovering the need, what's happened, what problems need to be solved. And then when we put together this care plan, how can we create this around this family that checks all your boxes? Because again, this is home care is beautiful because we can come alongside the individual in a very, very unique way and that family to the way that they want.
I'll tell you, Ethan, your passion and your energy for this mission comes through so clearly. So this next question, I think, is going to be an easy one for you, and ask it frequently because we do work in a difficult business. We're dealing with people sometimes at their worst and their most vulnerable, but there's something that we love about it that keeps us back and coming in. So what's your why?
Yeah. This is a generational business for me. I'm third generation of helping seniors remain at home. And I hope one day to pass this on to my kids because truthfully, there is no higher calling, and we see this in the Bible, than to take care of those who need our help, for the
Sure.
widowed and the orphan. And the fact that I have the ability to be in this industry and have, in my opinion, the highest calling, I get to wake up and do that every single day. How can you not? How can you not be excited to do this? And then not only that, but those who are in the care team who are often overlooked, we have the opportunity to look them in the eye and say, we love you, we care about you, and there's a home for you here forever. And so it's a great initiative. It's something that I'm passionate about. Our preferred care at home partners are passionate about. And so that is my why.
Wow, that's fantastic. And you guys are all over the country, right? So tell us a little bit more, of the business information. Where are you? How can people learn more about you? Specifically, if someone has your same passion and has your calling and wants to become more part of the preferred care at home team, what should they do?
Yeah, like healthcare is a calling, home care is a calling. You know you have it, and so if you wanted to open up your own agency, you can feel it in your bones. That's what I always say. We never have to sell it. You'll know it. Preferred Care at Home has strong footprints really on the East Coast. We have locations in Texas, Colorado, California, but really all along the East Coast. In Arizona, you're going to find Preferred Care at Home locations. By far, our biggest footprints would be in Florida, and of course in Tennessee, where our corporate headquarters hubs are. Yeah, and if they ever wanted to learn more, you can find more about Preferred Care Home at preferhome.com, or honestly, just find me on LinkedIn. I'm on LinkedIn, probably maybe a little bit too much. So look up Ethan Guerrieri. I'm on LinkedIn, and you can connect with me. I'd be more than happy to talk to you about either home care opportunities or even going through the maze of home care. Because, and I don't want to drag this on too long, William, we talked about how Medicare doesn't cover this. But there is other benefits like Medicaid that does. There's Medicare Advantage plans. There's Medicare Part B through the GUIDE program that's offering respite care. If you have long-term care insurance, if you're a veteran. So there is a lot of options for payment diversification that you may have granted to you that you don't know about that can give you some respite and consistent care without it being out of pocket. So if you're looking just to navigate that, feel free to connect with me.
Yeah, just make the call, right? You know what?
Yeah.
I'm sure I can tell that people in your business or your company are going to be willing to walk through that with somebody.
You got it.
Give them the options they have. Well, man, it's great talking to you today. I really enjoyed the conversation. You're doing great work. I will definitely be following along because it's clear that you're serving a big need. It's one that's only growing. And I hope that these emerging technologies make this more and more successful for you to do so.
Awesome. Thanks for having me.
My pleasure. And thank you, everyone, for listening. This was a great episode today. I hope you enjoyed as much as I did. And hopefully we'll see you next time on the Healthcare Algorithm. Until then, be well.